In your view, what are the biggest challenges in transitioning to non-oncology care and then from pediatric to adult care?
Yeah, so I think the biggest challenge is conveying that potential risk for late effects and the need for ongoing lifelong surveillance. I think a lot of times early on when we're delivering a diagnosis and talking about treatment, the focus is really on the now and baby steps and getting through this step, and then we'll go to the next step. And we're not really thinking long term at that point, and I think that's okay. But when treatment's over, we have to talk about next steps, because if we don't, we might lose people because they think everything's done, and then we haven't yet gotten to the part where we talk about the potential late effects, and we lose people who don't come back because they think everything's over and now they're fine. So we as the medical community need to be better about early engagement in survivorship care, why it's so important that we keep seeing them. And then I think, you know, the follow-up care, it's all exposure based. We know what potential late effects to look for, but we also know as oncologists, but we also know that the majority of our survivors are actually not followed by an oncologist. They're followed by a primary care provider. So I think that poses unique challenges to survivorship care when we know that most of our survivors are actually seen in the primary care setting and not in the specialist setting.
Right.
I mean, as you can imagine, I know all the friends that I have that are PCPs, they're very busy people. They have a full schedule, dozens of patients every day. When they see a survivor, if they lack the information they need about the diagnosis and treatment, they're not going to know what to look for and what to do. And even if that information is available to them, they may not know where the guidelines are to help tell them what they need to do, or even know that guidelines exist. So we need to do a better job of conveying that key information, which I think one is a survivorship care plan, and then the other is just disseminating the guidelines and just broad awareness that we have these evidence-based guidelines that provide guidance for what to do based on the treatment exposures that the child received.
Well, along those lines, what are some of the key sort of milestones or touch points as you go through that process?
Yeah, so I think, you know, as we discussed early on during treatment, really our focus is on achieving cure, minimizing toxicities, and just maximizing quality of life while the cancer treatment is happening, maintaining health as much as possible. Once the treatment is complete, then our focus will shift on surveillance, assessment for recurrence, catching up on missed well-child milestones. That early survivorship period, we often talk about revaccination or giving vaccines for those that were missed, reintegration into school, other activities that were part of everyday life before the cancer diagnosis happened. And then as we move farther and all those things start happening, we get into like real survivorship time. And that's where the risk for recurrence is pretty small. So we're really focused on potential late effects and health maintenance. We do a lot of counseling, healthy behaviors, what are good lifestyle choices, what are appropriate diet, exercise recommendations, tobacco avoidance, just common sense stuff. We want our survivors to live the healthiest possible life they can. And then a lot of it is disease prevention and screening, surveillance for the late effects that we know they might be at risk for based on the treatment they received. So I think, you know, those are really the transitions or touch points that I would think about as you evolve from the treatment to survivorship area.